When you hear the word seizure, it can sound frightening. It's often associated with serious health issues, and for many people, seizures can feel like a mysterious shadow looming over them, especially if they or someone they care about is dealing with a brain tumor. If you've ever wondered why brain tumors lead to seizures, or if surgery or medications can really help, you're not alone. In fact, millions of people face this confusing and scary reality every day. But the good news? There are ways to manage these challenges effectively. In this lecture, we'll unravel the connection between brain tumors and seizures, explore the treatment options available, and shed light on the journey of living with brain tumor-related epilepsy, BTRE. Understanding these issues can empower you or your loved ones to take informed steps toward better health. What's happening in the brain? Let's start with the basics. What exactly is going on in the brain when a tumor is present? Think of your brain as a bustling city, full of electrical signals traveling like cars on roads. Each road has a specific purpose and function, helping to keep everything running smoothly. But when a brain tumor develops, it's like building a construction site in the middle of that busy city. This construction creates traffic jams. It disrupts the normal flow of electricity, leading to abnormal brain activity. This is where seizures can come in. Seizures are like unexpected roadblocks or detours in our city's sudden, uninvited events that can throw everything into chaos. These seizures can vary in intensity, from a brief flicker of confusion to full-body convulsions. It's important to note that not everyone with a brain tumor will experience seizures. In fact, research shows that about 3,100% of people with brain tumors may have epilepsy at some point. The likelihood depends on factors such as the type and location of the tumor, how quickly it grows, and its grade. The different phases of seizures. Imagine if every seizure had its own personality. Some might be mild, like a quiet interruption, while others could be loud and chaotic. This variety helps explain why people with brain tumors experience different seizure types. Types of seizures. Focal seizures. These start in a specific area of the brain and can cause a variety of symptoms, such as twitching, strange sensations, or altered awareness. Generalized seizures. These affect both sides of the brain from the start, leading to symptoms like loss of consciousness or muscle stiffness. Recognizing these patterns is crucial because they can help doctors tailor the best treatment plan. The power of diagnosis. When a person experiences a seizure, it often raises alarms, leading to a trip to the doctor. One of the primary tools doctors use to understand what's happening in the brain is an electroencephalogram, EEG. This test is like a weather map for the brain, showing electrical activity and helping to pinpoint the source of abnormal signals. With this information, doctors can better diagnose conditions like brain tumor-related epilepsy and start discussions about treatment options. Treatment options for BTRE. When it comes to managing brain tumor-related epilepsy, there are several paths that can be taken, and finding the right one is key to regaining control. Let's look at the main treatment options available. 1. Anti-epileptic medications, AEDs. For many, medication is the first line of defense against seizures. Think of these drugs as traffic lights, helping to regulate the chaotic flow of electrical signals in the brain. Some common medications include levetiracetam, often prescribed as a first-choice medication. It helps reduce seizure frequency. Phenytoin, a long-established AED that can be effective but requires careful monitoring. Valproic acid, useful for various seizure types, it also works to stabilize mood. Lamotrigine, known for its effectiveness in treating focal and generalized seizures. While these medications can be powerful, it's crucial to remember that they can interact with other treatments. For example, treatments for the tumor itself may have side effects when taken with AEDs. Therefore, communication between healthcare providers is essential to minimize risks. 2. Surgery. When medication alone isn't enough, surgery can step in as a strong ally. Imagine having a stubborn roadblock removed to restore normal traffic flow. The primary goal of surgery is to remove as much of the tumor as possible to stop seizures. Surgeons may first conduct tests to identify the exact location of abnormal activity. This careful approach helps ensure that as much of the tumor as possible can be removed while minimizing damage to healthy brain tissue. 3. Radiotherapy. Radiotherapy is another option that may help control a brain tumor and, in turn, reduce seizure activity. It focuses on shrinking the tumor and can often work alongside chemotherapy. However, the effects of radiotherapy on seizures specifically aren't well understood yet, so ongoing research is essential. 4. Chemotherapy. For certain types of brain tumors, particularly gliomas, chemotherapy can be a helpful addition. It targets and kills cancer cells, which can also help decrease seizure frequency. Common chemotherapy drugs include temozolomide and combinations like procarbazine with lomustine and vincristine. Frequently asked questions. Now, let's tackle some common questions surrounding brain tumors and seizures. How often do seizures occur with brain tumors? Research suggests that about 2/3 of people with a brain tumor may experience at least one seizure. In fact, in 30–50% of cases, a seizure might be the first symptom that leads to the diagnosis of the tumor. What are the final stages of a brain tumor? In the later stages, symptoms can intensify, leading to increased seizures, drowsiness, difficulty with movement, and cognitive challenges. During this time, maintaining comfort and managing symptoms, including seizures, becomes a priority. Will removing a brain tumor stop seizures? In many cases, yes. Total removal of the tumor is often the most effective way to stop seizures. However, the results can vary based on the tumor type, location, and other individual factors. Looking ahead, hope and support. Living with brain tumor-related epilepsy can feel overwhelming, but there is hope. Many people manage their seizures successfully and go on to lead fulfilling lives. Treatments continue to improve, and ongoing research offers promise for the future. If you or someone you know is navigating this journey, remember that support is available. Connecting with healthcare providers, support groups, and community resources can make a significant difference. Conclusion. Understanding the complex relationship between brain tumors and seizures is crucial for anyone affected by these conditions. Whether you are dealing with the challenges of BTRE or supporting a loved one, knowledge can empower you to make informed decisions and seek the right treatments. The path may be difficult, but with the right information and support, there's a brighter road ahead. Keep asking questions, seeking answers, and advocating for yourself or your loved ones. Together, we can navigate this journey towards hope and healing.